Welcome to the Ambulance Suppliers using the ABN webinar. The ABN is the Advanced Beneficiary Notice of Non-Coverage. I am Tom Ryan with WPS Provider Outreach and Education. I'll be your presenter today. Today I'm joined by Mary from my team, who's going to help with the questions in the chat, and she's going to add some additional links you might want to know. As I said, this webinar focuses on the ABN, or Advanced Beneficiary Notice of Non-Coverage. This is the CMS form R131, which did have recent updates, and that's part of why we're doing this webinar. Today, our goal is to help you understand the correct use of the ABN and how to complete it correctly. This is especially important because ambulance suppliers don't have many situations where it's required. They do have a lot of situations where it's optional. So we'll talk about required and optional use. That's part of when to use the form. Then we're going to talk about the different sections and how to complete the ABN, because required and optional use have different sections that have to be completed. In other words, for an optional use, you only complete a certain portion, where for a required use, you would have to complete the entire form. Last, I'd like to move to a Q&A session and answer your questions. I do want you to note that the CMS R131, or the Advanced Beneficiary Notice of Non-Coverage, this is a form that cannot be changed. It could be something you put onto an electronic version, and that's fine. But because it is an Office of Management and Budget approved form, now that's the OMB, and they do a review and approve it every 3 years. We'll talk just a little bit more about that. I want to remind you that disclaimers are at the end of the presentation. Again, they will be available to you just after the event when I send it to you. Also, if you have a question, I really do encourage you to put it in the chat. Let us help you. But again, Mary will talk more about those questions at the end. The first thing we were asked to address is, when are we required to use the ABN? When do we use the ABN? There was a variety of other questions about that within the information asked during the pre-submitted or pre-registered questions. So I built a section for this. If there's more clarification needed, please put that back into the chat. We'll get you that information. First, just to kind of kick us off here, what is the ABN used for? Again, the ABN is the Advanced Beneficiary Notice of Non-Coverage. It is an outpatient form, and it is the CMS form R131. The ABN explains why the ambulance supplier believes a service is not medically necessary at the level provided or not covered for this patient today. So it does have a dual use. It's two different uses. This allows the patient to decide if they should accept the liability for this transport today. So the goal of the ABN is to help the patient have a better understanding of the ambulance transport. The Medicare You handbook contains information about ambulance transports that is sent to the ABN, or that is sent to the patient. Again, the Medicare You handbook is an annual publication. It is considered the guide or the handbook that every Medicare patient has to know what's within it. And it does contain information about ambulance transports. We wanted to highlight the fact that there was, or is, an informed decision. Again, the ABN is required for certain uses and it's optional for other uses. Keep in mind, if you're presenting the form at all, you must be able to explain it. You have to help the patient understand why they may be financially liable. This means that if it's a not medically necessary service at that transport level, they need to understand that. My example, and I'll use this one a lot, is that an air ambulance transport is ordered, but upon the EMT assessment, it's discovered that ground would be a safe means of transport. Now, the transport is medically necessary, but not at the level that is being ordered or that you are transporting them, the air level. Here's the difference. The patient owes you from the ground level to the air level. That difference is what we're considering for not medically necessary, okay? Now you can also look at it from a not covered, Medicare covered, Medicare uncovered, non-covered, however you want to term that service. And this is based on the Social Security Act. In particular, you're going to look at Social Security Act section 1861S7 because it has to be a transport. It also has to be medically necessary. Those are two type things. And we'll talk more about that as we get a little bit more into it. I was asked if there is some change that happened with it, and the answer is absolutely. As I said, this is an Office of Management and Budget reviewed form. These reviews occur approximately every 3 years, every 3 years. So just something to think about is this form was reviewed and is now dated March 31st, 2029. If you are not using that form, again, that form with the date March 31st, 2029, that is in the lower left corner, you are not using the correct version. You had until May 11th, 2026 to begin using this version. So you want to make sure you're grabbing the correct version from the CMS website. Okay, before we go any further, I'm just going to flip to the website and I'll show you the steps for locating the correct version, because again, that can make it all invalid if it's not the correct version. So let's go ahead, move to the website. The first thing you need to know is this is on the cms.gov website, not Medicare and not Medicare.gov. Medicare.gov is the patient side. CMS.gov is the provider side. You guys are providers? Okay. So where do you go from here? You'll want to select the term Medicare, and this will open a new dropdown. On this dropdown, stick to the left side and you'll see a variety of different items you can pick from. When you scroll to the bottom, you'll notice fourth from the bottom, there's forms and notices. Select this item. The right side of your dropdown will change and there are 3 options. The third option says Beneficiary Notice Initiatives. That is what the ABN is part of, so we're going to go there. Once this opens, you're going to see a lot of information. The easiest way to find the ABN is to simply scroll down and a chart will appear. The first item on the chart is the Advanced Beneficiary Notice of Non-Coverage, or the CMS Form R131. The top part is the form itself, and I'm going to open that in just a moment. But the bottom part is just the PDF instructions. We do recommend that you take a look through the instructions should you have additional information needed. Let's go ahead and open this form up. Okay, so the first thing mine does is says that I have to save it. The second thing it will do is allow me to open the document folder. This is what my document folder looks like. Okay, we're going to open it in File Explorer. Now, yours may not have that restriction. Yours may automatically open in File Explorer, and that's great. Here are the different versions you can use. We're going to focus on the English version, and I'm going to use the PDF version. Now, again, you can see English and Spanish, and you can see the different information you'll need. So we're going to do this PDF version right here. When I open this, what we're talking about is right here in the lower left corner, you'll see it says 3/31/29. The reason this is important is, again, this is the most current version. It was the one that was approved by the Office of Management and Budget, and this is when it is valid until. Okay, so there we go. Let's jump back to the PowerPoint. Let's verify with Mary that everything is back to the PowerPoint and that I can go ahead and move on.
Everything looks good, Tom.
Thank you. All right, so what's next? Well, next we do want to talk about the two options you have for use, because remember I said there's an optional use and there's a mandatory use. So what does that mean? Well, this is actually defined in the Internet Only Manual, or the manuals. It's in the Medicare Claims Processing Manual in Chapter 30 for the Financial Liability Protections. This is section 50.2. Okay. With all of that said, this manual is available on the CMS website. You can go ahead and plan to get a link to it. It will be on the bottom of the slide deck, and you can see it's already put there. If I want to open it, I simply select that link and it will open chapter 30 in the Medicare Claims Processing Manual. And then I have to scroll or search for 50.2. Now again, 50.2 is the section number. All right. So what are we looking for? ABN use and the optional use. Use and the optional use. Okay. The reason this is important is that, remember I said the ambulance benefit is contained in section 1861. And I'll show you this again, but what's the first thing under optional use? And that's where we get this from. Okay. So we'll move a little bit further back into the PowerPoint. So mandatory use is medically necessary. This is section 1862A1A of the Social Security Act. What that means is that a transport is medically necessary, but the level of care provided is higher than the patient medically needed. The best and most well-known use of a mandatory ABN is for an air transport when the patient could safely go by ground. That means that time makes it a better use of ground, or some other thing. It makes the air transport above what's needed. So first, yes, this transport is needed, and the only safe way to get the patient there is ambulance. However, air is not needed due to the patient's condition or time. Okay. So that means that the part that is medically necessary and payable by Medicare is the ground transport. The part that would be the patient's responsibility if an ABN is properly executed, we'll talk more about that in a few moments, is the difference between the ground transport and the air transport that was provided. Okay, that's the only mandatory use. Now, someone did ask me that about the verbiage, because CMS does state it's any ambulance transport where it is at a higher level of care than is medically necessary. There are still criteria and stipulations built in that says an ALS assessment, if based on the dispatch reason, is medically necessary, even though it winds up being a BLS transport. Well, why is that? So it isn't necessary, and you would bill the ALS because you got to do the assessment to decide how critical the patient is and do they meet the ALS standards for your area. Okay. There's one more use type. So we talked about mandatory, but there's also an optional use. And I showed this to you directly in the Internet Only Manual. And the optional use is something that does not fall under the benefit category in the Social Security Act, section 1861(7). So what does not fall under? One, part of what reads through is that it must have, again, let me remind you, it must have a transport. Well, that means that an ambulance treat no transport does not meet the definition, period. Therefore, those are optional uses. Two, there is a safe means the patient could be transported by, even if that means is not available at the moment. Let me give you an example here. The patient could safely go by a wheelchair van. However, it's 2 in the morning and no wheelchair van is available. That doesn't mean they couldn't safely go by one. It just means it's not available. That means the ambulance transport will probably not meet medical necessity based on the assessment given from the EMT. Also, the destination or the service at the destination is not covered. Give you an example here. Medicare covers a physician's office rarely. The only time it would be considered a covered destination when billed to Part B is for an intermediate stop in case of an emergency requiring emergent care to the patient. It is not the intended destination. As a matter of fact, Medicare gives you two different options for an indicator for this. That indicator is the second position of the origin and destination modifier. Okay? So P is a physician's office. That one is not a covered destination. That is an intended destination. X is the covered destination because that's the one meeting the exception. One thing that I want to remind everyone, CMS does provide the patient a handbook. This is updated annually, and it is the patient's responsibility to know the information within this handbook. The handbook is available for you to view on the Medicare.gov website. Let me go to that handbook. I'll just show it to you, then we'll come back here. Okay. So again, we're going to go to the website. Sorry. And we're going to go to the Medicare.gov website. This is different than CMS because the handbook is written for a patient. Go ahead and close out of this. Go basics right here on the top. Inside basics, you're going to see Medicare You handbook. When we look at this publication, you are able to scroll down and you are able to download the PDF version. Now, you can look through this on an individual basis. I prefer to just use the find feature. That is Control and F, which is the find feature. And I type ambulance. What it says is, you can see as I typed, it brought up the first finding. I continue to go on so that it moves me through whatever I want to find there. Now on page 32 is the ambulance services information. So it does explain this information. This is what the patient is required to know about ambulance services, okay? So it talks about grant transport, gives us the destination, and it also says when any other means of vehicle could endanger their health. So this is what the patient has to know, which is why 1861 S7 is the exclusionary portion, because this is summarized in the patient-friendly verbiage. Let's go back to our PowerPoint. All right, so Mary, again, did the PowerPoint come back when I left the website?
It did.
All right, well, we'll keep you scrolling right along. CMS does also have some times when you should never, ever give an ABN. These will make sense once I say that. But first, if the patient is under great duress, like at the scene of an accident, you should not give an ABN. Or if the patient is mentally not able to make a rational, informed consumer decision, you shouldn't use the ABN. So really what we want to do is look at that information and make a decision. Who does that? The emergency medical technician does that. Where do they document that? In their assessment. Okay, again, it's part of their assessment. What else is important to make sure? One, I want to remind everybody, and we get this a lot, we get that it was a 911 emergency transport order. Does that mean that you have to or can never give an ABN? And the answer is neither. It means that the EMT, upon assessment, determines if the patient is under duress, is mentally able to make that decision. Also, is an ABN even required? How many of you have had the time where your EMT shows up, they go to load them, and they say, But what do you mean you're asking for transport? My bags are packed and you're ready to go, but the patient's up and walking around? Okay. Or they're dispatched to what they expect is a heart attack, but when they get there, it's the patient is deceased and there's no emergency actions to take. Not ABN situation. Okay. Another time you should never use the advanced beneficiary notice of non-coverage is for all transports. And all is exactly the key word there. It's not used for anything where you expect Medicare to pay. Don't ever do that. If you're expecting Medicare to pay, don't give an ABN. This is a routine use, and a routine use means that all ABNs, even the ones given correctly, can be discounted. So those are the times when you should never use an ABN. Hopefully that makes sense. All right. We were asked a little bit more about never using an ABN and in specific situation. What happens when it is a fee schedule bundle? First, there's a little bit of a difference going on here. If it is truly being paid for by Medicare, the base rate does include all items, such as your supplies. If the base rate is medically necessary, then do not provide an ABN for things that are bundled into it, such as the supplies. On the other hand, if the base rate is not medically necessary, or it is a treat no transport, then yes, you can bill the supply code separately. It would fall under a not covered service. The ABN would be optional. Okay, the ABN would be optional. So it's not about never using it, it's about deciding medical necessity first. And if it is a bundled situation, then the answer is never use it. If it is not a bundled situation because Medicare does not consider the service payable or medically necessary, then you can use it. Hopefully that makes sense to everybody. Next, we were asked if we could walk through the new form just to cover the sections and what's changed. And the answer is sure. This is what we're going to do. I did show you where to locate the information in the new form, but I want to remind you that this is the actual steps. On the bottom, there's a couple of different links. First is the ABN form and instructions. And second is the Medicare Claims Processing Manual. Again, section 50 to help you out there. When to complete this form. First, if it is mandatory or optional and you are going to use the form, complete the form before the service occurs. This can happen after an EMT assessment occurs. So before the transport occurs, but after the EMT assessment, yes, you can stop and complete the form. Do you have to? Again, in most situations, the answer is no, because it is a not medically necessary transport, which makes it optional. The only time you have to is when the level of transport is higher than what is medically necessary for that patient's condition. That is the CMS verbiage. You must properly present and explain the form. Well, the present part is easy. You can present it electronically or on paper, and explain it can be a bit more difficult. That's why we showed you the Medicare You handbook, because it's got very simple wording that CMS uses. If you can't explain or if you are not getting the patient to understand, you do have to stop the transport. Do not complete the transport. Allow that patient to call 1-800-Medicare. Let them ask the questions they need. That is part of explaining the form. Once you've done this, you've located the form, you've completed the form, you've explained it. I want to remind you that when completing the form, providers do complete the top part, and we'll go through this section by section. So please don't feel like I'm just going to throw some stuff out there. The top part starts with the patient information and ends with the cost estimate. That's always required. From there on, the patient will choose an option, signs and dates, and then there's an additional information section. That's optional use. And yes, the provider can add information, but so can the patient in that section. So we'll talk more about these different sections. Okay. Let's also do a couple of completion tips. One, these completion tips are for mandatory use only. Remember, mandatory use occurs when the transport is higher than medically necessary for the patient's condition. Our example is it's ordered at air and being completed at air. However, the patient could safely go by ground. So complete the form. When you look at the identification number, which is right up on top, it is your internal number unless it contains a social security number or a Medicare beneficiary identifier. Then leave it blank. The identification number is not a required field. It is an optional field, and the patient uses it to contact you to identify to identify them within your system. That's why it's an internal number. Okay. On the reason, please be specific. We'll talk more about that. In the estimate, incorporate what you expect the patient to pay. We'll talk more about that estimate in just a few moments, but we wanted to bring up just a couple of things to think. Also, if it is a required use, the patient chooses an option. You must explain the options without influencing their choice. This one allows us to bill Medicare, but if Medicare denies it, we're going to pay it. Or you're going to pay it. This one says, don't bill Medicare. We're actually going to charge you for the transport right now. And the last one says, I don't want the transport. It's not medically necessary anyway. So please don't transport me. Okay, those are the three summary options. We'll talk more about those as we get into it. All right, so here you're going to see a couple of pieces of information for optional use. One, remember, it is only used for non-covered items, which is not meeting the transport definition in the Social Security Act. That's a non-covered item. Medicare will never pay for that. This includes things like treat no transport. The transport is not medically necessary. In other words, the patient could safely go by any means of transport. When you do this, you do not complete the entire form. You do stop at the cost estimate. And we'll show you that. We'll talk a little bit more about that information. Here we go with the actual form and the different pieces of information. So if you see that I have a screenshot and then I have the different pieces of information, what I would like to do is bring that form back and we'll walk through it while you follow along on the form. Now, again, in the slides, you will get all the different pieces of information I'm using here. So of course, right at the top, you see the patient name. This name must match Medicare. In other words, our eligibility system gives you a patient name. This is what we're looking for. Then you can see underneath that is the optional identification number. The reason that it's optional, we just explained. Cannot use what? A social security number or a Medicare beneficiary identifier. It must be something within your own system. That's why it's optional. If we slide to the right side, the first thing you'll see is the notifier name, address, and phone number. This is contact information for the ambulance supplier and should be the name known to the patient. Why is that important? How many of you work for a city or work for a different entity that owns them, but you're doing business as blah, blah, blah ambulance supplier, blah, blah, blah ambulance company? The name you want to give the patient is what will they know you as so they can associate this to you. Then you can move down. A couple of things to keep in mind. Medicare used to have a line right here, gone. So that's one visual indicator. Also, on this paragraph, they used to have a D with a mark and then you had to fill it in. Notice this statement right here has been changed. So you don't have to fill in the D with the mark. It's just automatically there for you. So that's a little bit easier for you. Then you get to the item, test, service, or care, ambulance transport. You do not need to break that down and say your base rate, your medical supplies, your whatever. No, don't do that. Just give them the ambulance transport. The patient may not understand all the other concepts, but they're going to know the ambulance transport. Then the reason Medicare may not pay, there was no transport, or it was a treat in place. It is not part of your Medicare benefits. The transport is not medically necessary today. A variety of different things could be put there. The estimated cost, don't break down and have ambulance transport and then 4 different items in the estimated cost. Don't do that. You're going to do what would it cost the patient if it was a private pay transport. Incorporate all costs into one line for an ambulance transport because that's what the patient understands. I will then go back and say that is our recommendation. CMS says if you break it down under item or service, so ambulance base rate, you got to explain that. Supplies, et cetera, so you break it down, then you must have associated costs to each line. Again, is that harder for a patient to understand? We do feel like it is. If you're using this for an optional use, you're done. The patient doesn't have to pick an option. They don't have to sign. You could put something in additional information, okay? But let's keep moving down a little bit. Next, you will ask the patient on a mandatory use which option they want. You want to pick 1? Yep, you want the service. 2, you want Medicare bills. And if Medicare doesn't allow, then you can be charged. Now, this doesn't mean if it's a transport or a situation where you couldn't charge them up front, yes, you can. Okay, doesn't mean that if it's a ground to air and there's additional charges going on because they could have safely went by ground, yes, you can ask for that payment up front. We're not saying that. Then we move on to option 2, which says, look, I just want to pay the bill. Let's just move on with it. And that means that the patient's going to pay now, understand that they are responsible for that difference, that medically necessary transport to the higher level of care provided. That's the difference. What will Medicare consider the medically necessary transport? What will the patient owe the dollar amount up to the higher level of care provided? Look, just let me pay it, okay? Or they can simply say, yeah, I don't want the transport at all. I don't want the transport at all. A lot of people have asked, what should go into additional information? This is kind of a catch-all for everything. So, does the patient have a supplement plan that might cover it? Is there a witness that you want to add their information to? Did the patient choose a different option, which is totally fine, but you'll add that information in the additional information area. So a variety of different things. We'll talk more about choosing a different option in a little while. Next, and this is going to be on the next slide, it's the mandatory use sign and date. Again, this is required when it is provided or when you provide a medically necessary transport but at a higher level of care than needed, then the patient or representative must sign and date this form. Note, if it has a representative, it must indicate that. You can use representative, anything like that. You can always add in additional information who that representative is to the patient. Okay? We'll talk more about that in just a few moments. All right, so we're going to jump back to the PowerPoint. We're just going to move down through these slides, which I just went through with the actual form, but I did bring them to you just as you'll have the notes. I don't need you to actually take notes. I'm going to give you the notes and it'll be in the form of a slide deck. Okay. What's important to know? Again, estimate based on what the patient is expected to pay. Always estimate high versus low. That means that if you think it might be a higher level, than what you're actually thinking, or the patient might be stuck with a full dollar amount, it is better to estimate high. Go for the full amount versus estimating the difference. Again, CMS says it's better to estimate high because the patient isn't really hurt if that happens. Where if you estimate super low or at a different level, it can actually affect the amount the patient pays, and that can be confusing and hurt the patient. 2, you may have to stop a service and complete the ABN. Well, I've said this a few different times. Because the EMT assessment drives the advanced beneficiary notice of non-coverage and whether or not it is needed, you may have to stop after the assessment to say, hey, this isn't medically necessary at this level. Fill out the ABN, present the ABN, and then complete the transport, okay? Regardless, you always get to provide the patient a copy. You do have to, again, explain those options, but don't tell the patient what to pick. Don't give the patient any advice on that. Here's the options. What that means. Now the patient must choose, or the representative must choose. If the patient has unanswered questions, they're going to ask you a question and you're like, I don't know the answer to that one. Let them contact 1-800-Medicare before signing. So give them time to do that, build that in. We received quite a few questions on what happens if a patient refuses to sign the ABN. First, Medicare recommends not providing the transport. This is because it is not a medically necessary transport. On the other hand, there are other laws and things that will require this because of how it was dispatched or what the patient is expecting. In that case, you will need to document on the form. Where would you document on the form? Additional information. You're going to put who refused to sign. Was it a patient? Was it a representative? Was it both? The date they refused to sign. Now, I want you to look at the bottom item and I want you to notice the sub-bullet saying optional. WPS encourages you to have a witness to the refusal. This witness is optional, not a required CMS thing. However, if called into court, the witness can help you support that you did present it, that the information was given, and that the patient did refuse to sign. What do they really need to hear? That the patient is refusing to sign for the information provided. They don't need to hear the full explanation or anything like that, but they do need to hear that the patient is refusing to sign. I did have a very, very good question. And the question was about someone who has Medicare and Medicaid, and there's some optional verbiage that you have to take out. First, when you are mandatorily using this, you must take out, which means strike through. Don't delete it, but strike through it. The patient should still be able to see it, and you can see the exact example on this slide. I gave you the manual reference as well. Because the patient cannot be asked to pay now. The patient also will not be responsible even without an appeal because they are a Medicaid patient and it's not allowed. Okay, so you'll notice that there are a couple of sentences there that have a strike through in them. Hopefully that all does make sense. That's the Medicaid dual eligible piece that some people were asking about. Last, we had a very specific question, and it is about how is the patient informed? And I think this is coming from the difference in how you receive your remittance advice versus how the patient receives their Medicare summary notice. First, Medicare summary notices are issued with payment to the patient. Okay, they get those right away. In a situation where you're using an ABN, there's a portion that will not be paid, right? Or you're using an ABN as an optional use and the whole thing won't be paid. This is considered a no pay for the patient. In other words, we're not claiming payment, we're not looking for payment, we're not asking for payment. So Medicare does not issue the ABN right away to them. I'm sorry, does not issue the MSN right away. What they do is every 120 days, they issue the MSN. This is why you're getting phone calls asking you to explain or to say, Medicare hasn't even made a decision yet. How are you billing me for this? That was the specific scenario given, which is why I brought that in. So you're getting it because they haven't even received their summary notice yet. Just something to think about. You can refer them to medicare.gov and they can log into their account and look it up. That's fine. You can let them know that you have received your remit notice, however you want to say that, and that is considered your Medicare decision, and that they will be receiving theirs within the next 120 days. In the meantime, they, are eligible to pay this. So next, I was asked some billing questions, and they relate to the modifiers that can be used and then the occurrence code. So we'll talk about those coming forward. The first modifier is GA. GA is used to indicate that it is a mandatory use. Mandatory use. The other thing that you want to keep in mind, it means that you did give the ABN and that it was properly explained. So it can be used on a 1500 claim form, 837I or P, and also on a UB04. Any of those types of claim submissions, which is actually all of them. If the patient does refuse to sign and you properly documented this, you would still bill with a modifier GA. If this comes in, Medicare says, ooh, wait a minute. Yes, we agree that the ground portion was medically necessary, but it was provided at air, so there's a difference in the cost. It can assign that difference to patient liability. The next modifier is GX, and this one is given when an ABN is provided for optional use. Optional use. Okay. It's just a nicety. You didn't complete the whole thing. You completed the beginning down through the cost and you were done. Remember, the patient's actual guidance is given to them in the Medicare You handbook. All right. Next, GZ. GZ is used to indicate to Medicare that you should have given an ABN because the service was provided above the medically necessary transport. In other words, ground would have sufficed, but you did an air transport. This remains the provider liability. Therefore, the GZ modifier, always optional. It doesn't affect anything. It's not required. The last billing item you might want to be aware of is for the occurrence code 32. The occurrence code 32 is only for a UB04 or an 837I billing. This is a facility-based ambulance transport that is medically necessary, but was provided at a higher level of care. They can put the 32 on it without the GA, and with a 32, they actually will need to include the date the ABN was given. So again, some different billing options. Make sure you use the one that best fits your scenario. Let's go through some registration questions, and then we're going to look at any questions that are in the chat. So we'll start with the registration questions that you submitted. We'll then move to the chat questions. So, oops, sorry. The first registration question is, what types of runs will not be covered? And the answer is for completely not covered or never covered or non-covered, whatever term you want to use there, you're looking at one, an ambulance run that was not medically necessary. In other words, the patient could safely have gone by a different means, regardless of whether or not that means was available at the time of transport. On the other hand, if you're looking for not medically necessary, You are looking for an EMT assessed run that ambulance is the only safe means of transport. However, it was provided at a higher level of care than the patient's condition required. Air to ground would be the example there. How do you adequately convey when your crews are responsible for giving an ABN? When do they need to do this? Now, this is really up to you and whether you're going to use it in optional situations or just medically necessary. The first thing we always recommend is that you convey to the crew member, an EMT at any level, could be an intermediate, a basic, or a paramedic level, that they need to do the assessment. When assessing, they must determine if there are medical skills required or if there is a monitoring that would require them to monitor the situation. If that is not the case, then it is an optional use. Give it, don't give it, that's completely up to them. If it is that, then they have to look at what is the safest level of transport for that patient, and are you transporting above that level? Hopefully all of that makes sense in those steps. Our next question actually deals with a 911 call. So a 911 call does not drive the medical necessity portion. That is actually driven by the EMT assessment. The 911 call and the dispatch protocol together drive emergent versus non-emergent. But until the EMT assesses the patient to determine whether it is even medically necessary, we're not going to look at whether or not it was 911. Keep in mind, 911 alone does not prohibit the use of an ABN. I gave you the situation where your EMT arrives, looks at the patient's having a variety of different things going on. Okay. Also, there are situations and areas within the country that all ambulance transports come through 911 regardless. So we can't say just because it's a 911 call, automatically going to require or not require an ABN. Next, can the ABN be signed electronically on the run report if wording states the same as the info on the paper copy? Or does the ABN have to be filled out on a specific form provided by CMS? First, yes, the ABN can be signed electronically as long as it meets the requirements in the Internet-only manual. No problem. Read the directions for that. Also, read the directions for completing the ABN. One thing I want to caution you on, if the patient says, I want a paper ABN, you must stop and provide that versus the electronic version. So yes, it can be part of it unless the patient wants a paper copy to sign. Then stop, give them a paper copy, do the explanation, go through all the steps. Next, should the ABN form be supplied when the patient signs an ambulance refusal form, although there is not a cost associated at the time of service? An ABN is not required in this situation. It is optional. If you want to give it, great. If the ambulance refusal is there, then it is considered a treat no transport, which is non-covered because a transport did not happen. Did not happen. You would bill with the appropriate code for a treat no transport and no mileage. You didn't take them anywhere. That makes it an optional use. What happens with the ABN, or do you need to give an ABN when a family member says they want the patient transported to a further away facility? This is an optional use. This is a patient or family member preference. Also goes with provider preference. Here's what you need to remember, especially if you're billing ground mileage. You would have an A0425 to the nearest facility. You would have an A0888, which is non-covered mileage. This is a statutorily excluded code. You shouldn't have to go beyond that nearest appropriate facility. And again, why are you? Because the family member asked you to, not that it's covered. What does this do? One, it makes the ABN fall into the optional situation, not the mandatory. Second, the A0888 does give the patient appeal rights without an ABN. It is the patient, their family member, or someone acting on their behalf. So you would make sure this is billed accordingly and then optional ABN use. The next question is, when is it to our advantage to use an ABN? And the answer is, it's to your advantage to use it if it is a mandatory use, which means that you are providing a transport at a higher than medically necessary level. Yes, the transport's medically necessary, but you're still providing it at a higher level. And that's kind of the key going on there. Okay. Why is it to your advantage to do this here? Because you will be given the opportunity to bill the patient the difference between the medically necessary level of transport and the transport difference you are and the transport level you actually provided. That's what the whole purpose of the ABN is. This one is a great question, and it's going to provide a full summary to everything. Oops, sorry, I forgot one question before I do that. When Medicare did not, if for inpatient and the patient is not, well, this isn't an ABN situation. If Medicare denies the ambulance transport for inpatient, but the patient isn't, this is a bundling situation, and it's an inpatient bundling, depending on if they're in a hospital situation or a skilled nursing facility. A lot of times what winds up happening is you go to bill the ambulance transport for the outpatient service, and the discharge is not updated within the system. So you get to wait until that discharge updates. Unfortunately, this does happen. All right, now back to that question. That's really going to wrap everything up. So when is the ABN really needed? It's really only required for situations where the transport is medically necessary, but you completed a transport at a higher level of care. In most cases, we have found this to be true for air transport when the patient could safely have gone by ground or the time required for air is greater than the transport by ground. An example of this is that you have to dispatch the fixed wing air. It comes into a airport. The ground transport takes them to the fixed wing. The fixed wing flies them to another airport. The ground transport then transports them to a hospital. That total time may be longer than if they had simply been loaded in a ground and taken them in the first place. That's just an example, okay? So with that said, we will move on and ask Mary, are there any questions in the chat? Mary, I can't hear you if there is there anything there? All right. I hope Mary can hear me, and I hope y'all can hear me, but I will let you know that I'm not hearing anything from Mary. So I'm going to go ahead and do a wrap. Oh, sorry, let me just go back. Okay, no questions in the chat. Perfect. I'm going to go ahead and do just a quick wrap up. If you have a question, throw it in the chat. I'll get back to you. All right. First, I want to remind everybody that in September, we are hosting, or not we, there is a national AB/MAC ambulance provider and supplier coalition. WPS is involved in this coalition, and we will be available to answer questions during the coalition. There will be a presentation on ambulance medical necessity, which is really good. The time to submit a question has passed, but you are allowed to register. So you can register for this event definitely right now. You're definitely welcome to do so. Okay, if you go to our live events page, you can select it from the chart. Scroll along to the bottom of the chart, you'll be able to select it. If not, and you want to wait for the slide deck to be sent to you, awesome. Go ahead and do that. We wanted to remind you that there is a national provider enrollment uh, conference coming from CMS. So we want to make sure that this information is given to you and that you can register for this. The registration not quite open yet, but it is coming. It is coming. But keep in mind, it will open in September, and you are aware that it is November 18th and 19th. That's the provider enrollment conference. I'm stuck. Okay. Next, we will close out with a survey. Mary put a link in the chat. You can definitely take a look at that survey. I want to remind you that the survey is a way for you to give anonymous feedback. It just simply says, here's what you know about the training. Here's what you know about WPS. There are 5 questions to start, and you can select to give more. Completely up to you. A couple of things I want you to be aware of. One, I will close this webinar, and when I do, you will get a page like the upper right side that says external site. Not malware, not spam, not malicious anything. It's us asking you to take the survey. And I wanted you to note that it says CMS Mac FedRAMP.gov. 1, that'll indicate that we're on the correct website. 2, anytime you are in a YouTube video from us, which this will be made into an encore, you'll notice online surveys on the bottom, and it's just a picture of what we will do to post the survey. All right. So thanks for attending. In a few minutes, you're going to receive an email thanking you for attending. Please don't delete this email. There are 2 important things. 1, the email will have the PowerPoint that I just used attached. Also, it's going to give you your certificate of achievement should you need that for continuing education hours. We don't actually do continuing education hours. So I just want everyone to be aware of that. So you'll be able to get that information. All right. I will let you know that you have 7 days to send me any additional questions from this. I do know that there was a question in chat, only I'm not able to get it. I'm not seeing it at all. So if Mary wants to put that back into everyone can see it chat, which is a little bit different than the direct one where you're going to send us a question, put it into the everyone can see it chat. We'll go ahead and answer that in just a moment. But if you have any additional questions, you have 7 days to send them in. Please put, ABN for ambulance and ABN webinar, something like that. Again, you're going to use that wps.gha.education@wpsic.com email address. So let's see, what is the question? What is the applicable HCPCS code to use to bill Medicare for a treat no transport in order to have the patient receive? Oh, those one's easy. If you come out and you're looking up treat no transport, so you can say ambulance code treat no transport. Now, I'll tell you, this is the same code you're going to bill, and you'll see that it comes up as an AO998. Yep. Why is this the code that you want to use? Well, because this is the code that best describes the treat no transport. It is a HCPCS code. When you bill the AO998 to Medicare, please include the GY modifier. Just makes for faster processing. If you build it without it, we're still going to deny it. But to make it faster processing, when you look at HCPCS codes, it is always going to be a standard code that you're going to bill, which is why I did use and look up this way. If you look up a standard HCPCS code, remember it's the modifier that will drive. Is it a GA, GY, anything like that? Hopefully that does help you out. Right. So just again, back on, and we'll go ahead and finish up here real quick. So I want to thank everybody for listening. I do encourage you to take that survey. Give me the feedback. Remember, I want to know what's good and bad. So there's going to be 5 questions. Provide some additional feedback. If you would like to send us a follow-up question, do so in the next 7 days. They have to be related to ambulance somehow. It would be better if they were related to ABN, optional or mandatory use. Please remember to sign up for additional ambulance education coming later this year, including the conference that's coming up for all Macs. On behalf of Mary, myself, and all of Provider Ocean Education, thanks for attending. You can now disconnect.